And Sabrina on.
Who's that?
Well. There we go.
Are you ready up there as far as the associates there?
I believe so. Yep, already.
Okay. Good enough. Well, I'll call the Health and Human Services. First thing I want to do is it's never too late to congratulate you mothers. You deserve all the respect and everything that we can acknowledge. So first thing I want to do is acknowledge congratulations to you ladies for Mother's Day. Then we'll move on. Number 2 is approval of the agenda.
So move.
Madam Secretary, any discussion on the agenda? I think it's pretty straightforward. All in favor, say aye.
Aye.
Carried. Approval of the April 13th minutes. And copy. Any questions? Move for approval.
So move. Second.
Clerk, you got that? Any discussion? All in favor, say aye.
Aye.
Motion carried. Disclosure, I don't see anything there. Anybody for public comments? Welcome back, Chad. I don't think there's anybody in the building for public comments, so we'll move on. Number 7, COVID-13 updates, and we'll turn that over to Tanya.
And I have Jean coming down. She's on her way right now. She is going to give that update.
Morning, Dr. Lagus. Welcome.
Sure.
You want to hold up a minute for her, Tanya?
Yes. we can.
There she is.
You ready for me? We are ready for you.
Lady.
So COVID update. So just want to talk about the month of March totals. We had a total of positive cases of 158. In April, we did close out with 353 positive cases. So we did more than double the amount of cases. And then last week we had a total of 91. So we're still trending up. We have a very high case level for our county. So right now we're still trying to focus on messaging and getting people aware of how to stop the spread. But with that being said, good news, between January and May 6th, we have given out 10,000 doses of the vaccine. But our demand is going down, and we are currently in the process of scheduling our mobile vax clinic for the summer. We will be posting on our website and Facebook where we're going to be in the community. We have a 2-week confirmed schedule, so we'll be working through Polk and Burnett counties. So on Thursday, I believe we're going to be at the Frontier Agricultural Place. On Friday we'll be there. Thursday will be a second dose clinic here.
So those 91 cases last week, were they all positive?
Yes.
Okay, thank you.
So our percent positivity for the state still is about 11%, or for our county is 11%. The state is at 4% and decreasing. Ours is going up. So still trying to get that best public health practice message out. Total 33% of our county population has completed the vaccine series. So that's about a 5% increase from last week. So that's really good news. So for our mass vaccine clinic, we are ending that. Our last second dose day will be May 20th. And like I said, we're moving to doing mobile clinics in the community. We are offering a walk-in clinic starting today in our government center for vaccine, and that's 9 to 3.
That's today.
It starts today and it'll be every Tuesday.
I was there this morning and they had one. Couple more coming in.
Yep. And then we are offering saliva tests Monday and Wednesdays, 8:30 to 1:30, and that started last week. Last week totals, we had 47 tests done, 9 of those were positive, and yesterday we had a total of 17 tests completed. So we are finalizing our COVID health equity grants. We're working with Burnett County, the ADRC, and we have involved some of our tribal partners as well, and also working with Chet's Pharmacy. We're hoping for each community mobile site we go, we're hoping to offer Moderna, J&J, and Pfizer at each location. Pfizer vaccine, it should be announced by the end of the week that we can use it for children 12 and older. So we're hoping to coordinate with Chet's to really reach out to our school-age children where that's the spike that we're seeing right now. For school updates, just want to bring attention that last week, Waukesha School District, which is outside of Milwaukee, had voted to no longer follow quarantine and close contact guidelines. And that is the trend that we're going to be seeing also in our area. The other health officers that I'm in contact with in our area have noticed this too, and a lot of our school districts have gone away with the mask mandate. So I have a feeling this is where we're going to as well. We're working with the state on stronger messaging and what the authority is of public health officers in this case and what will happen if there's a huge outbreak in a school.
Can you repeat that, Waukesha?
Waukesha School District, they have voted to no longer follow close contact or quarantine guidelines. So if they have a student
That
who,
includes masks.
yes,
I think from what I've seen in the county, most of the schools around here voted to continue masks till the end of the year, right? Bill, what do you?
Unity has not. I think they just released theirs. So the kids, I think it's optional for the kids at Unity. They just did that, yeah.
Frederick is not wearing masks either.
and luck is not either.
Did extend,
Osceola and St. Croix extended it through the end of the year.
Yeah, the end of the school year, so that doesn't address fall yet, or summer school. So that's the other concerning thing is that we are seeing an uptick of
You know
cases
anything
in
about
children.
Unity,
how many people do we have in the hospital?
That I didn't get to yet. I didn't get that data this morning. What?
Oh, I congratulate.
Yes, please.
Nice to have some discussion, Brad, so we know what's going on around.
Yeah, so that's definitely I feel that's the direction schools are going to be looking to, that there's going to be the pushback, and then what do we do when there's nobody reporting these cases and it just keeps spreading because we have people who are not vaccinated.
Quarantine vote, is that the person who hasn't quarantines, obviously?
So it's pretty much going to be up to the parent to determine if the child is sick with COVID to send them to schools. The school will no longer send children home with possible exposure to COVID.
Exposure, but a person who is a known case
Yeah.
quarantine.
But the school won't enforce them. So if they still show up to school, they're still going to stay at school. So it's really going to be up to the parent to keep them home and follow those.
They have it.
So, and that's what Waukesha started, and now it's just kind of going to spread through the states. And then that's pretty much what I have for COVID. Do you have any other questions?
Chad, along with COVID, I don't know if you're on the agenda later, but you're pretty much in charge with the COVID funding and that. Tanya and I was talking prior to the meeting. You want to give us any update on?
I was gonna tie that, if you're good with it, I was gonna tie that into number 11,
Sure.
because they kind of tie together.
Yeah, good enough.
What were the hours for the saliva testing?
9:30 to 1:30.
So how are we getting, is it through the, pretty much Facebook, or how are we getting the people to know about our clinic here this week?
So what we are doing, we have created a flyer, and we're going to utilize our volunteer pool that we have gotten from our Mass Fax clinic. And we're going to print out a whole bunch of copies and go to places that will allow us to hang the signs up, and in probably grocery stores, places that people are going to, asking that, and then also doing a push through social media, our website, and our partners. So the schools and hospital partners have agreed to share our flyer for people to be aware of, that they can come here for testing. They can also get a vaccine here, but if they know we're going to their community, they can also come get a vaccine there.
Website was the key that I was looking
Yeah.
for.
We definitely put everything on the website and
I
Facebook.
know nothing about.
So we're gonna also look into figuring out some radio ads as well. For our health equity grant that we got, I did put $2,000 aside to do radio advertising. And then also
Pay for that?
yes. And then ADRC also has, we partnered with them and they have the funding for the printing, and we're putting a flyer in all the newspapers. So we're going to try to hit all sources that we can think of to promote our vaccine clinic, our testing, everything, and where to just get information or have questions.
We have, Tanya, do you know anything about that? Do we have somebody once? So I know, I believe Chris is on the Amory radio once a month.
Yeah, we get invited to go down there every now and then. We're not on there once a week or once a month. We did have, I don't know, it was a month or so ago, we had a couple of our nurses go down and talk about vaccine clinic and.
I think Chris is, I think he's kind of got a schedule once a
We
month.
all of the
I
departments
mean,
kind of
that'd
take
be all
turns to go
plus
down and
this,
talk.
right?
Mhm.
Yeah.
How do we get the word out that our infection rate is 7%?
Well, it is on the county's website,
It
on
is.
that dashboard.
And then we can also, I'm thinking too, to create some messaging that has these like more of a weekly update for Facebook when we get the final numbers, that we can share that. And then also share it with the partners that we have, and looking to sharing it countywide to spread the word.
So how are we gonna get the county information to the schools? Like, if I know the schools, you know, if you get some group of kids that'll say, I ain't gonna do this, then well, then follow the leader type of thing. Where if we can be adverse on this,
Yeah, so the other thing we're working on is doing a TikTok competition, which is another social media platform to help and do an incentive for kids to create their own messaging around COVID. We created some guidelines. We're just finalizing that to help get kids awareness and spread the word. So kids telling kids about getting vaccinated.
and kids under 18, they don't need parents' permission or anything. They're
For the
under-
TikTok video, we do have a
As the
statement.
actual
Oh, for the
vaccine, are
vaccine?
they on their own?
They do, and they need permission, but it's still gray if the parent needs to be present. So the parent needs to sign a consent form, but does the parent need to be present is still the gray area.
Are you involved in that very much, Dr. Lagus?
No, I just know about it this morning on. Joe talked about vaccine. Well,
Good.
I think that's gonna be our big challenge from now, which is now, is the, teenagers.
Getting them back.
Well, I think one of the issues would be that if you want to play sports, if you want to play sports, first of all, you got protect yourself so you don't get ill. Because you're not going to be running track very well if you have COVID. So you're not going to be able to do baseball in summer or maybe even fall sports. So I think that's what we need to emphasize to young people, that if you want to be healthy and be able to participate in whatever activity you want to do this spring and summer and fall, you should make an effort to get your parents to allow you to be vaccinated.
Would it be possible, I mean, Dr. Lagus is Board of Health physician, would it be possible to have media, it should certainly be in the minutes, but in our media that, our Board of Health physician, Dr. Lagus, encourages the younger
Absolutely.
teenagers and that? That'd be okay, Dr. Lagus?
Absolutely.
And we can connect after this to discuss.
You got a comment on it?
And just an additional comment, in the media or the publications, there's already a lot of vaccines required to go to school. So this isn't like something unusual, and I think parents almost forget that we already require measles and, all the things that to go to school. And so this is just yet another vaccine, and it's not a big deal, and I think they should.
And that's something we talked about internally, is like, how do we incorporate this into a back to school message? Like, you need your yearly physical, like what I remember going back to school, making sure you're shots are up to date. So how do we get that into part of our conversation that COVID isn't going anywhere anytime soon, that this is something we have to talk about long-term impacts.
Right, yeah, and it's not a big different thing. It's just a vaccination,
Yeah,
you know.
very good point.
Bill,
I think, Gene, one of the things that you may want to do too is contact each one of those school districts. See if you can get a hold of the superintendents. There's only 8 in the county, and see if you can get that on the front page of their webpage.
That's a good idea.
Because you have parents accessing that all the time, besides students. And I think that if you get that on that front page of their website, with a real positive message, even if you get, you can quote Dr. Vargas, with that, I think that might make a huge difference.
I think that quoting people who, people are know and are confident, good response from their superintendent or principal, that would be absolutely even better than quoting me.
The other thing we want to do is make a why we got vaccinated video, and hoping to pull from some of these age groups that have already received a vaccine and just asking them why you got vaccinated and see what we can
Great
do.
idea.
So we're working on that. We're getting the equipment we need. It's part of our health equity grant. So we're working on our volunteers who are going to be in our video right now. So we have members from the tribal community, farmers, healthcare. We're looking at students and who else we can target.
and once again, our challenge is those homeschool kids that's just a gray area that needs a lot of update and a lot of lack of participation. There's some that are doing excellent.
Yeah, we're hoping to go
talked
to
to
some
some kids
community
that-
fairs too, to even just pass out information, like they can get a vaccine there, but also just encourage and have that conversation.
If you want to go to Wanigan Days this summer and the Polk County Fair this summer,
Yep, we have a whole list where we're gonna be.
Absolutely.
you know, you
Another place to put it too, I think, would be like Osceola has a monthly newsletter. That on the front page too.
We're definitely gonna reach out to all of those. So wherever someone's gonna take our flyer, they're gonna take it.
Very good.
Well, thanks so much, Gene. Any other questions?
There was just a couple of weeks ago where a family went away on vacation. Had COVID.
I saw that.
Yeah.
Really sad. But now the vaccine is available, that's a real tragedy.
Anything else, Tanya, under COVID or?
Oh, but it looks like Jean has the floor for a little bit.
I have the Loveless Lake update
You
too.
want?
So,
They're done.
yeah, so last time we were here talking about our Loveless Lake toxic algae situation. So we did go and take another water sample on April 23rd and had the water tested for toxicity level. So the EPA recreational water standard is 8.0, and our second sample came back at 6.9, which is still higher than the 6.4 we had for the first sample. So right now, since this is a new toxin to the state of Wisconsin, there is really no set water sampling plan, mitigation system. How do you monitor this? So we're in constant communication with the DNR on what we should do next. So I'm currently looking at our environmental health funding to see how much water testing we can fund, because it's $85 per water sample itself. And then the overnight shipping cost makes it about $200. So we need to figure out what is our long-term strategy. The other option that the state recommended is these toxic algae test strips. And pretty much what it is, you take a sample of water, you add some chemical solution and you dip a piece of paper in there, and it will tell you if it's above 10 parts per billion of toxicity, which is above the 8.0, but at least if we're above 10, then we know we have a high amount of toxins and people shouldn't be swimming that day. But it's that gray area that what happens if it's below 10? It could still be above 8, but below 10. So what do we do? So we have a lot of unknown answers and lots of questions. And I'm working with Land and Water on this now and what we can kind of figure out for a work plan. But definitely next steps is increasing messaging, especially about using lake water for irrigation on people's lawns. Kids, pets all play in the grass. The algae itself, we can't see. So if the kids are rolling in the grass, pets are, you touch the pet, you could possibly ingest it. So there has been a report that a cat died from this possible exposure in the grass in the state outside of Dane. And that's the other thing. I have to contact Dane County to talk about what they're doing about this. And then again, just the work plan and how do we address this long term. I'm getting some permanent signs made. I'm glad I waited to have a different message to say to maybe you should swim at your own risk because we don't know what the toxicity levels are because we take a sample, it's only that day. And if there's different conditions, that toxicity level can go up or down. So not great news, but lots of questions that need to find answers.
On your bill or anybody, do you know if there's ever been any history? This is just a total shock that Loveless Lake came up with this.
I'm not aware of any.
Is Bob coming in or,
Yeah, and this toxin is new to the whole state. Like we know of it, but nobody's seen it this bad in a lake. So that's why it's kind of like, what do we do?
Reports we received were about 2 years ago.
oh, there you are, you got some comments.
It's relatively new. So we're learning along the way as well.
How many
I'm
lakes
totally
are?
shocked at Loveless Lake, and they can know the lake pretty well. There's really no filtering in from anywheres.
There are some concentrated flow areas that contribute to the lake. And we're looking at those right now, one in particular. But the source of this algae bloom cannot be tied to one particular source. So it's many variables.
There isn't any record of dead fish or anything that we can isolate.
Any other lakes in the area that?
Not that we know of yet, but there are some in Minnesota that have had reports of this particular.
Just like the blue-green algae.
Yeah, it's part of the blue-green algae family, but ours happens to be like a purplish red color.
Planktothrix rubescens.
Yeah.
Have you had anything up in Burnett County at all?
I know that one lake up in maybe Burnett or Cumberland area. The one lake that I went to here about 3-4 years ago, I didn't even put the boat in. I was in that lake all the time. And all of a sudden, it's all that blue-green algae.
Pretty much every one of our surface bodies of water has some form of blue-green algae in it at certain points.
Anything else, Gene?
Nope, that's all I have. Once we have more of a plan in place for Loveless, we'll be happy to share.
So we're gonna move on to number 9 then. You wanna address, you got some things to address?
Sure thing.
You got the podium.
Mr. Chair. I've got a groundwater study update for you. I'm happy to say that we are moving forward with that. We have drafted a letter for the Wapagasset Lake Watershed residents. That'll go out May 19th. Okay, I've got a couple copies here. If you'd like to.
Goes out in email to the residents,
It'll go out in snail mail, so it'll get mailed to their physical address.
to their fire number.
Yep. Yep. Got a shuffle. So a bit of our timeline, we'll be collecting samples, sample kits, or allowing people to come in and collect sample kits Thursday, June 3rd, Friday, June 4th, Monday, June 7th, from the hours of 7:30 to 5 p.m. So the people will come in,
You don't happen to know how many miles of river we have in Apple River, Polk County, or how many river miles we have altogether?
Oh, boy. We do have that.
Yeah, on the spot.
Yeah, we do have that listed in our land and water plan, but off the top of my head, I cannot.
It'd be fun sometime when you just make a note of that. And at some time, it's always nice to get these things in the minutes. I was talking to an older gentleman this week about some things he read in our minutes. I don't think we really realize there's probably thousands of people in Polk County that read minutes of our committees, and especially our county board meetings. There's just tons of people that really look for that resource of reading the minutes of government things. So
I could get those stats if you'd like.
yeah, just some things like that are very helpful, very informative. Appreciate it.
Any other questions?
Just a quick,
Yeah.
you may have already said this, but has the Balsam Lake watershed been tested?
Yeah, we did that one in 2019, and we got an additional 100 well tests from that particular sample effort. So we've got that in a database, and we're hoping to add to it with this groundwater testing study.
You get a report, all the lake associations, I know they have someone that is testing their water all summer. Do they send that into our county?
That would be surface water you're referring to in our lakes.
The lake water?
We may get a few of those tests, but those would go to Colton and Caitlin, and I'm not aware of. It would depend on the program too.
I'm on the Big Lake Association. I know the hazards. Yeah. Maybe they send that right into a state level?
They probably do. It may not go through
I
us.
think there's quite a few of us. Joe, you're on the Cedar Lake in Polk County. Fran, are you on a lake association?
I'm on Amory Lake,
Yeah.
Ford, and Apple River.
I think the Amory Lake, some sampling weekly, and I know we do some beach testing in the summertime from Memorial Day to Labor Day. So that's mostly for health concerns in our swimming areas and things like that.
I know at the Lake Association annual meetings, they always have statements from some designee that taking lake samples consistent. I think every month.
Sure, they're pretty active. I would be surprised if they did.
The Hazard family does it for big.
DNR does it for Cedar.
Yeah, they're.
That's St. Croix County, which is the smallest part of Cedar, but they had that, St. Croix County DNR and stuff really involved in that.
They make the residents very aware of what their, water quality is. Go ahead, thanks. Anything else? Okay,
Thank you very much.
number 10, legislative events report. I visited with Sonia before the meeting, and if you remember here a month ago or 2 months ago, I was pretty excited when the governor presented his budget, and Chad and Vince, you seen a lot of pretty good news for Polk County financially. But I warned everybody that that was only a wish list. And so when the governor's budget went to the legislature turned down exactly every single solitary proposal that the government had in its budget, and said, we're gonna create our own legislative budget. And that has been ultra conservative and very detrimental to Polk County. You know, a couple of years ago, Joe, and that 2 years ago now, Joe and Tanya, some of us went down to, Madison, and we got a pretty nice increase in our budget for what
Child welfare.
child welfare, yeah, which was so dearly needed. And it came to the legislature, and instead of going along with the normal child welfare budget, they completed it out 100%. Well, the legislature did get so much heat over that the last couple of years that I believe now we might be right around 60% funded or 60,000.
Depends on the year. There's such an overmatch with county. I think it was 1,000% overmatch last time we were advocating for it. So they've got a ways to go to even come close to helping be at least 50-50 with.
Anyway, what taught the
Matching
legislature the lesson was the bills came in and they were astounded and they had to be paid. So they knew that they were on the hook for that. Just, that's about all I got on legislative until we get something passed, which hopefully I've been in touch with Rob Stafford and Gay, and we think we're gonna be all right on quite a few issues. That's all I can tell you. So we'll move on to our financial report, and that would be Dr. Todd. And
Dr. Todd.
Just whatever name you guys pick.
Yeah.
That's your middle name?
So Tanya wanted me to give you guys kind of an overview and a feel for how community service did this year. And understand this is unaudited because we're going through the audit right now. But I think to begin that, I want to talk about the COVID fund and the COVID costs, because before you guys get the wow factor from what Tanya's division gave back to the general fund this year, understand a lot of it was rerouted to COVID. So we have received, let me put it this way, we have spent $999,013.05 on COVID-related costs since the event started. We have received in funding $982,905.35. That means right now we've only spent $16,107 of levy dollars on COVID response. Everything's been through grant funds, the CARES grant, the FFCRA, the various grants. Community services gotten a lot of various grants. The two largest are the CARES money and the FFCRA. FFCRA was 471,000. I think we got reimbursed. And Tanya's got a number of large reimbursements.
Like Tanya, the vaccine clinic here that you started this week, that can all be billed back to COVID, your nurses' time and all that?
What we're able to do is, anytime they're spending time on COVID-related activities, including vaccine clinics, we can take those wages and apply them to those funding sources. So that's where you're seeing, where we have this significant give back to the general fund. A lot of it is due to.
So, and that's right. So, I mean, that's all, she's had to bring on, we brought on limited term employees for contact tracing, for disease investigation. We've run the vaccine clinics, all this kind of stuff. And so that's all gone to the COVID fund. So we spent right at $1 million, but we received right at $1 million reimbursement. So that's really good news.
I was in there and they had already given one, I think, when I was in there at 8:30. So can you charge the whole day's wages? I mean, they're on call for that all day. Can you charge a whole day's wages to the nurse for COVID?
Yep.
Well, it will depend on what their other funding sources are, because some of the grants or other funding we get will allow you to use COVID time also. So it just depends on how else they're being funded. So it just depends on which nurse is working and what else they're working
Yeah,
on.
because that's pretty important.
And so here's the important thing. So when I read you these numbers, understand that a lot of this give back is not because CSD was overfunded or over budgeted last year. It's because COVID is a very anomalous event that we shifted a lot of what would have been levy expense over to the COVID grant relief.
Can I just add one thing too?
No.
All of those vaccine clinics are about 75% run by volunteers. So we have a smaller pool of staff who are the core, coordinating and planning and actually doing vaccines and the other work that needs to happen. But I would say 75% of our workforce over there is run by volunteers. So that's how we were able to have such a
We aren't
successful clinic.
able to charge a volunteer.
No, so what we'll plan to do for the volunteers is have an appreciation banquet. Once the air clears a little bit, we're a little bit safer to have an appreciation event for them, but it is, they are volunteering their time. There's no pay involved in that, and they want to. The medical community has been fantastic about wanting to jump in there and get people vaccinated.
Interesting.
Yeah, I know one of my friends, but on Thursday, he's a retired pharmacist. I don't know how many hundreds are in vaccines for you guys.
It's fun. I've been
Yes.
there a few times.
I would just say too, while Chad and Tanya roll out the bottom line here, which is really impressive news and good to hear that getting that money refunded. What they're not talking about is how much administrative work, how much time and thought goes in, and the preparation of setting up the budget such that we could get this. So Chad and Tanya and all of our directors have done a great job, and they've recruited their staff to make changes in how they do it. So it's a minor miracle in my view.
Well, that's the point I'm trying to get at is like, Chad, now you spend are you able to charge some of your administrative time? It's certainly warranted.
Yeah, I charge some of mine to the FFCRA. Tanya's money, I can't charge any of it to. It's just something we have to absorb. But we recoup what we can. We've been really meticulous with what we've submitted. And I will say every dollar we've submitted, we've gotten back. So we haven't had any denials, which is good because all of this is auditable. And I think we're on really solid ground on what we've submitted. Because I haven't had one subsequent question, and we haven't had any rejections or resubmissions.
Well, that's good news.
So by resolution, Tanya's two funds, 215 and 216, clear back to the general fund at the end of every year. They watch back because of the COVID relief, and you hear how big that is. And because Tanya and her staff, just like the rest of us, did a lot of belt tightening in 2020 and kept positions unfilled, and we made do and things like that because we didn't know what the economy was going to be. The 215 fund put 1.249 million back in the general fund. And the 216 fund put 392,000 back in the general fund.
1.5 is Department of Children and Families, 216 is behavioral.
So between the two of them, they returned $1.6 million of budgeted funds back to the fund balance.
You
So,
know, you and I were talking about that 700,000.
So we have received additional funding for COVID-related expenses through, we have to make it last through March of 2022. So that's something that Jean and I will be working on with our LTE staff and how we respond. That's about 700,000 more dollars. That actually goes back to October of 2020. So we'll look at that 16,000 that you've got hanging out there to see if those expenses can be applied to that. So we'll have a zero if possible.
but overall, I think we fared COVID pretty well, and we've captured a lot of money back and recouped the county coffers considerably. So, you know, if I had to break it out roughly, I'd say 800,000 of that COVID fund was expenses directly related to Tanya's division. So that offset hers by 800,000 roughly. And the rest has been cost savings and holding positions open and good management and CSD that brought that money back. So I think that's a pretty big deal that they gave that much money.
Rita, as a nurse, I know you've done a lot of volunteering in some of the jail vaccinated, some different programs.
Well, here
and
at the-
that. Wouldn't you be able to charge that to this fund? And then, although you're donating it, I mean,
Just paid staff for a little bit.
It's paid staff for contact tracing, but for the volunteering, you can't charge that.
Yeah, so this
I
is,
mean, people are volunteering.
yeah, this is unlike the FEMA grants we did for the summer.
It's not in kind.
Yeah, so, and for FEMA for the storm response, we got about $100,000 in in-kind funding for the volunteer hours. There's not that money for this. This is just pure cost, actual cost incurred.
I guess that's what I kind of got in my mind. I'm trying to get at, like, on the FEMA fund. Yeah, I mean, so if she wouldn't have been volunteering, you would have had a higher, you know, and it would have been applicable.
A little different. Yeah, these pots of money are direct deposits into our accounts for us to manage the pandemic. It's
Good
state
thing we
giving
got
us
such a
money. We don't have
volunteer
to.
force. I know it.
And some are very specific, like just for testing. So that's where we bought the saliva test kits from. So some of it, there is specific pots for certain things. You have to be, because you can't just spend it on anything COVID related.
Yeah.
And the other difference is, like, for the FEMA response, we get 87.5% back once we submit for reimbursement. Here, we get 100% funding on all these. So it's been significantly better funding.
So, is that all for financial, or Vince, do you have anything? You got anything? I don't think you're on the agenda specifically, but I always want to touch base that if you have some comments.
The one thing I would just add, and you touched on it, volunteers are so important in this, and there are so many that we're worried about how do we recognize all the different groups of people who have volunteered in this. This isn't like a county or 2 or 3 storm. This affected everybody. So every county had to really chip in. Every chance I get now, I want to make sure we thank all the volunteers, because we couldn't have done it without them.
Well, something I've had in my mind for a while. I wonder. I've been trying to find a way, Tanya, that as our committee or as our committee or from our department, between you and I and the committee, maybe I was thinking in June, we should get some kind of publication out like we do this other stuff in Thanksgiving. Because, you know, I think if some of the volunteers just read that the public was aware of what they did, it gives them self-appreciation. I hope we can, maybe about June or something,
Yeah, we, like Vince said, there, it's affected so many and we've had so many different types of volunteers. We are collating all of that and we've got some hoopla in the works for everybody who's volunteered, kind of like we do with our foster care banquet. You know, we invite our board members to come and appreciate our foster parents for the work that they do. I know one year, Vince's first year, he came and thanked everybody as they walked in the door. So I think people recognize that and appreciate that, you know, at a board level or at an administrator level, that they are recognized and we see the good work that they do. And we're over there with those volunteers every week. You know, we're right on the line with them. So I think that's important to them too.
We'll get it covered.
Oh, yeah, for sure.
Hey, oh, one thing I've read, this is the second year that CSD has returned money to a sizable amount of money to the general fund. I think that's important to know. This is 2 years in a row. It's been big dollars back to the general.
As long as it doesn't go back to the state, that's what you're sitting up there.
These are levy dollars.
The key is in efficiencies, and it's not like we're money grubbers and squeezing, but rather Tanya is finding efficiencies, better ways to do business, finding those grants. And I think that's a tribute to how that organization is running. So good work.
Honor to our legislative cooperation.
Okay, so that brings us right in, if you're ready, that brings us into number 12.
Right.
So discussion of the 2021 budget priorities. So I just wanted to bring this back to you guys. Last month, we gave that pretty lengthy presentation on the meth and the substance use issues. And as you can see from the county board priorities here, reducing substance abuse is the #1 priority. So I just want you guys to, you know, have that food for thought in mind as we start looking at planning for 2022 budget. Most likely priorities are going to stay, you know, substance abuse and mental health are on all of our plans all of the time as priorities that we need to address. So as we move into budget season coming up now for 2022, I want this board, or the request is that this board, you know, consider what we're doing now, give us feedback on the presentation that we gave last month, and if there's anything different that you think we should be doing as far as our programming or, you know, how we're running things in community services in response to the county board priorities. So we'll bring that back probably June, July to talk about 2022 priorities. So you guys will all have a little homework assignment today to think about, you know, what's happening in the community and how we can respond in community services. And if there's questions, you know, call me, call the directors. They're happy to answer any of your questions about what we're doing. So any thoughts or discussion on that?
All right,
Okay, good.
you're gonna move into 13 then, well,
We're thinking, okay. Yeah, so keep turning that around in your brains for the next month here.
The wife and grandson, they went down along the property line yesterday and picked up all the trash that was in the ditch there and stuff. They come back with almost a whole bag, garbage bag, and most of it was alcohol bottles.
Oh, yeah, I did that too. I picked up with my grandson and ours. It's all beer cans and beer bottles.
These were alcohol bottles.
Oh. Well, they're alcohol.
Different percentage.
Yeah.
Yeah, our numbers are showing that, again, alcohol is our primary
Yeah.
diagnosis coming through the clinic. It's not the only, but it is one of the primary.
sure one of our gateways.
Just have a comment that I briefly made to Tanya too. Is, you know, meth, of course, is a huge, huge problem and extremely destructive. But yet, when we sit in meetings like this, alcohol is still the #1 by far. By what was it, double or triple?
Double.
Double is double the problem of anything else that is dealt with. But yet we don't really seem to talk much about what can we do or should we do, or what are options to do something with that issue. We don't focus on alcohol the way we focus on meth, and alcohol is twice the problem. So
What-
just an observation. So,
I can tell you that behavioral health and the CJCC have been working really closely with the DA's office on our IDP and IDI programs, which are for individuals who receive OWIs. And we just kind of finalized our brochure and streamlining that program to be, I think, a lot more efficient and effective. So I'm excited about that. And just ongoing conversation about what we can do and how we can do it differently. How do we be more proactive with regard to prevention? Because that's really where it needs to start, is working with kids, working with parents. Stop it.
and I think it's part of the issue, and I don't know if this plays into mental health or not, but it seems to be more socially acceptable
Exactly.
to abuse alcohol than it is to abuse meth.
Well, I can make a couple comments from our public protection and our health and human services is so closely related, and the problems where alcohol is a good share, a high percentage of the homes is available. Some of the others are.
It's legal, for one thing.
Yeah.
And it contributes to the economy a lot. It's a very powerful political thing as well, so.
Yeah, so in looking at our prevention efforts with our drug-free communities grants that we just received, our coordinator's on board, so she's got some pretty big tasks ahead of her to try to stop it, right? Early on, under age 18, so we don't get to the socially acceptable age 21 drinking and driving, which, you know, and it all leads into other drug use, methamphetamine, stimulants, marijuana.
You're gonna coordinate 13 in then right away with this handout.
Yeah. So this, I'm gonna take you back in a little bit of history here. So this is the Polk and Burnett County's 5-year aging plan. Every 5 years, they are required to do this for one of the 8521 grant, I think it's called. It's a transportation grant. That's how the ADRC funds their volunteer driver program, the buses that they have running out here. They use that money. The three-wheeled bike, motorized bike program that they have. It's all part of that 8521 funding. So this is their latest version. It's 2019 through 2023. There's a lot of good information in here. So another homework assignment for you guys. But even farther back than that, well, last year, I think it was last year, Supervisor Pritchard had brought up public transportation, and we had agreed to keep it on our work plan. And with COVID and everything that's been going on, we just haven't had a chance to talk about it. Now that things are settling down a little bit, it did come up on our work plan. So just gearing you guys up to start thinking about public transportation. So the key with this is to take it home and read through it, get familiar with it, and then decide, give us some direction on what you want to do with it. I will tell you, back in 2014, Joe, I think you were still you're on the ADRC board at that time, right? So even back to 2014, we had some very serious planning going on for a public transportation model in Polk and Burnett counties. It was similar to the transportation program that is in Sawyer County, as well as Ashland and Bayfield counties. I know Lisa's very familiar with what is up there. It's called BART, Bay Area Rural Transit. And then
Iron County as well now.
the one in Sawyer County is Namakogan Transit. So if you've ever seen those vans running around, those are public transportation companies that I think they blend their 8521 monies with some public transportation grants and a little bit of levy to make them successful. So we had very serious conversations back in 2014 about what would it look like in Polk and Burnett counties to have a public transportation model. We worked with the RTP, Rural Planning Transportation, RPC, whatever. Rural planning on, what are the needs here in this county? We are all set to do a transportation study to find out what the public wants. And it was going to be like a 50-50, I think it was about $10,000 to 10,000 to do the study, 50-50. Polk County anteed up and Burnett declined at that time. Remember that? So it just kind of died right there that we couldn't even get to the study to be able to figure out what we needed or what we wanted in this county. So those are conversations that are, I think, need to be mentioned again now as we look at public transportation needs. We want to know what the needs are before we plan anything. In talking with Laura Neve, the ADRC director, they are in the middle of their 3-year aging plan right now. We did a lot of surveys at the vaccine clinics, so they probably have the best response ever this 3-year cycle. But she said a trend is emerging that people are asking for public transportation. So not expecting anything to happen today, but I think it's something that we need to think about and bring back and maybe have ADRC at the table with us to talk about what is the next step as far as public transportation in at least Polk County. And she also has Burnett County, so that's why.
Just a quick question. So if we wanted to find out about Sawyer County or Ashland or those, can we just see it online and see how they do it?
I believe Namakogon Transit and BART both have their own websites. So you
just
could
go on and look at how it's structured.
And it's actually been amazing how they have branched out and, money-making endeavor, but it has just been such an asset to the community, and that's where I lived for the majority of my life until I moved here. And so, and they do, Bayfield County, Ashland County, they have vans that go to both the Red Cliff and the Bad River reservations. It goes up to Iron County now. It's always done in the Mellon area. It's amazing that service, what they cover.
Yeah, so being able to take a rural public transportation is a lot different than urban, right? Because we're covering some miles. So a lot of work was done in 2014. So I don't know if we bring that back and at least look at it or study
Not
it.
mistaken, the tribe refused it too.
Tribe didn't want to.
Here, our track.
So if you look at this plan, it does talk about, like on page 3 or 4 here, the goals for the 5-year plan. And it speaks to everything that I'm telling you here today. So, we are kind of responsible to address some of these things through the ADRC. Human Services is at the table, the tribe is at the table, all of the transportation providers in the county are at the table. So it's a very good read.
Tanya, and to the committee, I hope that can be our at least top 5, number 1 or number 2 goal in the county is public transportation. This isn't, it goes way back farther than that and talk about history, then it can tell you, yes. I think it was probably about 2000, we had some very adamant board members that were very heartfelt to public transportation. And St. Croix County has had theirs in force for way back, I think, over 20 years. I remember there was one board meeting about that time when we had somebody come up from Hudson. And I think one of the deputies came along with them and explained about their system there, how they'll stop in Hudson, take people to the airport. The hub is out of Eau Claire, and they take people to work and to the airport, and to the doctors. And they really have a good system that we came very close to implementing that, probably like 2014. Somehow the last peg didn't get done. I'm sure Dr. Laga said you have older people that really have a hard time getting to medical appointments. And that is very close to what you're, yeah, I hope we can all come together and anything we can contribute to the county board. It's gotta be the kicker right there.
Well, do we want to have it for discussion and possible action next meeting? I think at the minimum, you have to decide if you want to even study it to determine what the needs are, and then, whatever you do with that.
If we have this on our work plan, Fran, I'm hoping that at some point we can get enough information, like say from the tribes and what you have on the table there, that we can have a resolution of support to the county board.
Do we need to hire somebody to do a study to evaluate things, or is that information in here?
I think we first have to find out what is it we want to study, kind of narrow it down a little bit. And then we can do some investigating as what the costs are and so on.
Last time we were asking the RPC to do it, and that was the $10,000 cost. Rural Planning Commission. There's an office in
It
Spooner. and
might
an
be
office in
cheaper if we did it. Maybe, might be cheaper if we did it.
It's gonna take quite a bit. I think $10,000 is pretty reasonable to do a study like that.
Is
I don't know what it would be today. This is back in 2014, so.
like in our discussion now, that good information. It's workable in so many counties. And so we have resource information there that's so readily available.
I think first of all, we should all read the report we have.
Yeah.
Come back with questions. I think of well, what do we do? What kind of transportation are we looking for?
ADRC is currently working on transportation plan.
A lot of resources there. Pulled together.
And involve anybody else?
Well, would you like to take this homework home, bring back questions? I could have ADRC present at the next committee meeting, and we could answer your questions.
Yeah, we'll have it on the June agenda for discussion.
I think it would help the growth of the community too, to have this. I mean, it would make it more appealing.
If anybody has any resource from ADRC or anybody that would like to come in and address our committee, I'd welcome that.
There is a list of providers back in 2018. There's a list of the existing providers in the county, but you could also go to the ADRC website. They have a transportation page, and you can see the different types of vendors as well as what type of transportation they provide. Mostly in this county, it's for aging and disabled individuals along with veterans or low-income people needing to go to the doctor.
Anything else to address, Tanya?
I don't think so.
Before we, Madam Clerk, we didn't do a roll call and we have some people missing. Do you have everything down? Amy and
Is Amy the only absent?
Something you did, Johnny.
Gotcha. She's got you covered.
Before you even
number 14, and we're,
Two things. We'll bring back transportation. You guys bring the questions. We'll have ADRC here. And then discussing 2022 budget priorities. What you would like to recommend our division is working on. 2022.
Gene, have any more information on vaccinations for school? Could we get an update on that?
Probably have to roll into the COVID update.
Yeah, we have standing order COVID COVID update, I think that the LG, Loveless Lake will be a standing for a while. And then the waters, I don't know if you need the watershed study, if they have an update, we can ask them to come in. Okay.
Did we have anybody else on the roll camera?
Sabrina and Sharon are the two board members.
Did they have any comments there? Are we adjourning the meeting? Anybody got any comments? Vince, or- Bill?
Well, thanks, Tanya, for passing back all that money to Chad and Vince.
Anytime.
To the county.
Just remember, we might need the favor again
Oh, okay.
down the road.
Oh, okay. Gonna take us all out to lunch?
It's over. That was good.
It's against county policy to spend money on food.
Get back, please, you know.
Tanya,
Well, I think if we did any spending, it would have to be in the 2022 budget for transportation.
She muted herself again, so.
could you email the copy of the document that you guys were looking at there?
Yes, I will email it to Hannah, who will email it out to all of you in case you misplace this, or I do want to warn you to be careful because the stapler that I used this morning was really mean.
Karen, it's good to hear you speak up. Appreciate it.
Thank you.
Didn't hear anything from Amy. Was she on there?
No, I don't think so.
I don't have anything else ending, so we can motion to adjourn.
I make a motion to adjourn.
Motion by Joe, all in favor, aye? Aye. Have a good month, May, and we'll see you, I don't know, what day in June.